Question 1. Which classification does the medication lisinopril belong to? A. Beta blocker. B. ACE inhibitor. C. Calcium channel blocker. D. Diuretic. Answer: B. ACE inhibitor. Question 2. A nurse is preparing to administer metoprolol. Based on its classification, which vital signs should be assessed first? A. Respiratory rate. B. Heart rate. C. Temperature. D. Oxygen saturation. Answer: B. Heart rate. Question 3. Which drug class is most associated with a risk of bleeding and requires monitoring of INR? A. ACE inhibitors. B. Anticoagulants. C. Beta blockers. D. Anticonvulsants. Answer: B. Anticoagulants. Question 4. What classification is appropriate for furosemide? A. Loop diuretic. B. Potassium-sparing diuretic. C. Thiazide diuretic. D. Osmotic diuretic. Answer: A. Loop diuretic. Question 5. A patient is prescribed amlodipine. The nurse knows it is classified as which of the following? A. Beta blocker. B. Calcium channel blocker. C. ACE inhibitor. D. Diuretic. Answer: B. Calcium channel blocker. Question 6. A nurse should question a prescription for spironolactone in which of the following patients? A. A patient with hypokalemia. B. A patient with hyperkalemia. C. A patient on digoxin. D. A patient with fluid overload. Answer: B. A patient with hyperkalemia. Question 7. Which of the following medications is classified as a proton pump inhibitor? A. Ranitidine. B. Famotidine. C. Omeprazole. D. Sucralfate. Answer: C. Omeprazole. Question 8. A nurse is assigning a task to a licensed practical nurse, LPN. Which medication class should the RN administer instead of delegating to the LPN? A. Oral antibiotics. B. For chemotherapy. C. Topical antifungals. D. Subcutaneous insulin. Answer: B. For chemotherapy. Question 9. Which class of medications is primarily used to treat generalized anxiety disorder? A. Antipsychotics. B. Benzodiazepines. C. MAOIs. D. SSRIs. Answer: D. SSRIs. Question 10. Which classification does atorvastatin belong to? A. Beta blocker. B. Anticoagulant. C. Statin. D. Calcium channel blocker. Answer: C. Statin. Question 11. A nurse is prioritizing care. Which patient receiving a newly prescribed aminoglycoside should be seen first? A. A patient with a rash. B. A patient with mild nausea. C. A patient with decreased urine output. D. A patient with a headache. Answer: C. A patient with decreased urine output. Question 12. What is the classification of the medication warfarin? A. Antiplatelet. B. Anticoagulant. C. Thrombolytic. D. NSAID. Answer: B. Anticoagulant. Question 13. Which classification is correct for the medication albuterol? A. Corticosteroid. B. Leukotriene inhibitor. C. Beta-2 agonist. D. Anticholinergic. Answer: C. Beta-2 agonist. Question 14. Which classification is associated with a risk for rhabdomyolysis and requires monitoring of creatine kinase levels? A. Calcium channel blockers. B. Beta blockers. C. Statins. D. ACE inhibitors. Answer: C. Statins. Question 15. What classification does digoxin fall under? A. Antihypertensive. B. Cardiac glycoside. C. Beta blocker. D. Diuretic. Answer: B. Cardiac glycoside. Question 16. Which of the following patients should not receive a non-selective beta blocker like propranolol? A. A patient with migraines. B. A patient with essential tremor. C. A patient with asthma. D. A patient with tachycardia. Answer: C. A patient with asthma. Question 17. Which of the following is a benzodiazepine? A. Zolpidem. B. Lorazepam. C. Sertraline. D. Buspirone. Answer: B. Lorazepam. Question 18. A nurse is caring for a patient receiving vancomycin. Based on its classification, which is the priority nursing intervention? A. Monitor heart rate. B. Assess for tinnitus. C. Check pupil reaction. D. Monitor blood glucose. Answer: B. Assess for tinnitus. Question 19. Which classification of drugs is used as first-line treatment for hypertension in African American patients according to current guidelines? A. ACE inhibitors. B. Beta blockers. C. Calcium channel blockers. D. Alpha agonists. Answer: C. Calcium channel blockers. Question 20. Which medication class does the drug levothyroxine belong to? A. Thyroid hormone. B. Beta blocker. C. Corticosteroid. D. Anticonvulsant. Answer: A. Thyroid hormone. Question 21. Which classification does the drug clopidogrel belong to? A. Anticoagulant. B. Antiplatelet. C. Thrombolytic. D. Beta blocker. Answer: B. Antiplatelet. Question 22. A patient with Parkinson's disease is prescribed carbidopa-levodopa. What is the classification of this drug? A. MAOI. B. Dopaminergic agent. C. Anticholinergic. D. Benzodiazepine. Answer: B. Dopaminergic agent. Question 23. Which classification is appropriate for the drug zolpidem? A. Benzodiazepine. B. Non-benzodiazepine hypnotic. C. SSRI. D. Barbiturate. Answer: B. Non-benzodiazepine hypnotic. Question 24. A nurse is administering phenytoin. It belongs to which drug classification? A. Anticonvulsant. B. Anxiolytic. C. Antidepressant. D. Antipsychotic. Answer: A. Anticonvulsant. Question 25. What classification does fluoxetine fall under? A. SNRI. B. TCA. C. SSRI. D. MAOI. Answer: C. SSRI. Question 26. A nurse is caring for a diabetic patient taking metformin. What is its classification? A. Sulfonylurea. B. Biguanide. C. DPP-4 inhibitor. D. Insulin sensitizer. Answer: B. Biguanide. Question 27. Which classification is correct for the medication losartan? A. Calcium channel blocker. B. Beta blocker. C. ACE inhibitor. D. ARB. Answer: D. ARB. Question 28. A patient is receiving morphine postoperatively. Morphine is classified as which of the following? A. NSAID. B. Opioid analgesic. C. Antispasmodic. D. Antipyretic. Answer: B. Opioid analgesic. Question 29. Which class of medication is contraindicated with nitroglycerin due to risk of severe hypotension? A. Diuretics. B. Beta blockers. C. PDE5 inhibitors. D. Calcium channel blockers. Answer: C. PDE5 inhibitors. Question 30. Which of the following medications is classified as a mood stabilizer? A. Lithium. B. Fluoxetine. C. Diazepam. D. Olanzapine. Answer: A. Lithium. Question 31. Which of the following antibiotics is classified as a macrolide? A. Cephalexin. B. Ciprofloxacin. C. Azithromycin. D. Doxycycline. Answer: C. Azithromycin. Question 32. A nurse should question the use of a thiazide diuretic in a patient with which of the following conditions? A. Hypertension. B. Hyperlipidemia. C. Gout. D. Osteopenia. Answer: C. Gout. Question 33. Which classification best describes the medication prednisone? A. NSAID. B. Corticosteroid. C. Antihistamine. D. Antibiotic. Answer: B. Corticosteroid. Question 34. A nurse receives a new order for methotrexate. This drug is best classified as which of the following? A. NSAID. B. Immunosuppressant. C. Antibiotic. D. Antiviral. Answer: B. Immunosuppressant. Question 35. What is the classification of the medication sertraline? A. SSRI. B. MAOI. C. TCA. D. SNRI. Answer: A. SSRI. Question 36. A patient is taking isoniazid for tuberculosis. What is its pharmacologic classification? A. Antifungal. B. Antiviral. C. Antitubercular. D. Antimalarial. Answer: C. Antitubercular. Question 37. Which medication is classified as a leukotriene receptor antagonist used in asthma? A. Albuterol. B. Fluticasone. C. Montelukast. D. Salmeterol. Answer: C. Montelukast. Question 38. A nurse prepares to administer enalapril. What classification does this medication belong to? A. ARB. B. Calcium channel blocker. C. ACE inhibitor. D. Beta blocker. Answer: C. ACE inhibitor. Question 39. Which classification describes haloperidol? A. SSRI. B. Atypical antipsychotic. C. Typical antipsychotic. D. Benzodiazepine. Answer: C. Typical antipsychotic. Question 40. Which of the following is a classification for the medication glipizide? A. Biguanide. B. DPP-4 inhibitor. C. Sulfonylurea. D. GLP-1 agonist. Answer: C. Sulfonylurea. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.